just couldn't place them before, because you would isolate them and you would not give them enough exposure to the number of cases they need to see in residency. But it would be a good way to enhance and connect them to their urban training centers. So we need to think broadly about how to use telehealth, not only to expand healthcare access, but also to expand residency programs. We need to take our nurse practitioners and our PAs to full scope of practice. Nurse practitioners and PAs can run clinics on their own. They have to be under supervision of a physician, but the physician, a lot of times, they're not in the clinic. They're not there. We need to make sure that the ratio of oversight from primary care physicians, which we have fewer and fewer of in the rural areas, does not get in the way of having PAs and NPs running clinics. We need to take a look at that. We need to look at our pipeline models. There are some excellent models. In Sacramento here, there's a high school where every child that goes to the high school, every youth, I should say, they're heading into healthcare. They go to school in surgical garb, and they are planning to go into healthcare. We can provide other model and best practice programs and pipelines throughout a lot of the different communities, so we can recruit from those communities. It is really true what has been said. They stay where they get recruited from at a higher percentage, and we need to do a lot more support for programs that are pipelining youth, unemployed women especially, unemployed vets who come off of military service, who have education and healthcare training, so that they can stay into healthcare, or they can go into healthcare, and they're going to stay at home. Matter of fact, we're sponsoring legislation this year that will try to get rid of some of the licensing and education barriers that will prevent some of the 30,000 military veterans that come off of the military. Every year in California, a large percentage of them have healthcare training. That's a good source of fast-tracking them into a civilian healthcare. But we have barriers that prevent them and force them to start over again in their occupation that they've been practicing in the military for a long time. So we need to honor their service and also get them good jobs and get them into healthcare. That'll take care of some of the shortages. So I'm just throwing out a few of the issues that we're dealing with. The Healthcare Workforce Development Council is a setting that has a lot of folks involved that have been looking at this in depth, and should be utilized as a partner as you explore further. I just want to thank you for holding this hearing and exploring this. You have been doing this for a long time, the Health Committee and the members of the committee, and if we can do anything to help from the rural area, let us know.
Thank you very much. Please state your name.
Hi. Lydia Bourne. I represent the Blood Centers of California. I want to kind of divert a little bit from primary care physicians to the team that backs up these primary care physicians. And primarily, my few minutes with you will be talking about the clinical lab specialist. That is a very critical member of the team, and about 80% of the diagnostic determinations that physicians make are based on the lab reports that come from the CLS. In the Blood Centers of California, because we are involved in high complexity testing, we have to have CLSs. That is a person with an undergraduate degree. About 8 or 9 years ago, California instituted the MLTs. Those are 2-year degree people, and certainly that was a help in terms of addressing some of the shortage that we were experiencing, but it did not help the blood centers. We are unable to hire any of the MLTs. I'd like to share with you just a couple of ways that we've attempted to grow our own, as we call it. UCLA has some money in their budget, and they have, over the last couple of years, funded one CLS, and this is a person who's completed already their degree, who has gotten a temporary license and is now coming in to work in the blood bank. They have to go through almost another year of training in order to be qualified or essentially licensed as someone who can work in a blood bank. Monterey Peninsula Hospital is affiliated with the San Jose University, which is one of the remaining and long-standing programs that trains CLSs. But again, due to staff reductions at the hospital, they've had to cut back. They recently had influx well, I shouldn't say influx. They've had additional revenues come in, and they are now affiliated with De Anza, and they will be bringing on in April a MLT intern. Again, this will be for the hospital lab as a whole, not for the blood center. The Memorial Hospital System, which is located down in Southern California, it's a system of 6 hospitals. The Long Beach Blood Center has established a relationship with Dominguez Hills, again, one of the long-standing CLS programs. And they have been having a program going on for the last couple of years. They have only been able to train, however, 2 students per year. And once those students are finished, there are full-time jobs available for them. Just recently, they've been able to obtain some money from the Department of Labor in connection with the Pacific Gateway, which is the local workforce agency in that area. And now the stipend has gone from $6,000 to $12,000, and they're able to bring in 4 students a year now, in addition to also compensating the person, the CLS, who will be doing the training. With this program, the student has to agree to give back 2 years to compensate for the training and the stipend. So we're hopeful that this program will remain in effect for a long period of time. So those are, and up here in the Sacramento area, we have Blood Source, which has had a long-standing training program. Blood Sources and UCLA's programs are what they call limited license programs. What that means is the person comes in, gets the training in hematology, but that is the only field that they can work in. They do not have the generic or the broad CLS license. So that does create some difficulty in terms of people moving from one place to the other. Finally, I think there are at least 3 issues that we have identified. We need to, first of all, provide more support for lab field services. They are essentially the licensing agent for CLSs and MLTs in the state. And my centers are telling me that they're having difficulty getting potential employees licensed and or having their license renewed. So they have a long history, unfortunately. I mean, we all know what the budget situation is, but Lab Field Services has borne quite a bit of those cutbacks in the Department of Public Health. Secondly, we'd like to have conversations about removing or lessening some of the barriers. I think one of the things to do that would be setting up a career ladder. The MLT, as I said, is a 2-year program, and setting them up so that they can then move on to become fully licensed CLSs. And then thirdly, as everybody has said, we need more funding. We need more schools, we need more students, and we need to have more clinical training. I think until CSI came on the scene, very few students were even aware of the whole concept or even the occupation of a clinical lab specialist. And I suspect if you talk to some of these kids trying to get into these programs now, they'll tell you they want to be a CSI. At least some of the ones I've talked to have been saying that. So thank you for the opportunity to speak to you today, and for you, Senator Hernandez, for undertaking this very critical and important issue.
Thank you. And just for your information, we will be doing additional hearings throughout the rest of this year on allied health providers, maybe even clinical lab specialists. What I'd like to ask of you is to contact my office. Perhaps we can have you make a similar type of presentation when we get to those particular areas, because we want to start off with the physician shortage now, but we're going to address the entire workforce. But thank you very much for your comments.
Thank you.
Before we close, I want to thank Senator Blakeslee for coming in. I wasn't sure if you had any comments or questions at all from any of the panelists, but thank you very much. We will be having a series of hearings to address the entire workforce, not only physicians. We're going to be looking at allied health. We're going to be looking at nurse practitioners, physician assistants, optometrists, pharmacists, podiatrists, chiropractors, find out if we have a need, how we can integrate everyone into the medical home to make sure that we provide the best care that we can for all the patients, as well where the areas of greatest need, which is the rural, inner city, communities of color, and how we diversify our workforce. Anyway, with that, I'd like to thank everybody for being here. We'll go ahead and adjourn the meeting.